This is WCNY's The Capitol Press Room, and we're checking in on the Albany agenda for New York's community health centers, which are an important lifeline for New Yorkers in urban and rural communities in need of healthcare services, regardless of their ability to pay. And we're joined in the studio by Rose Duhan, President and CEO of the Community Healthcare Association of New York State, which represents more than 70 healthcare centers all over the state. Welcome back to the studio, Rose.
Thanks, David. Thanks for having me.
So I want to pick up the conversation in an area you and I have discussed since the summer of 2025, which is the fallout from federal changes to the eligibility for Medicaid and the process of qualifying for Medicaid, and the expectation that these changes are going to result in fewer New Yorkers actually on Medicaid. And given the fact that so many of the people that you serve use Medicaid as their health insurance coverage, what does that drop or potential drop, if it hasn't really come to fruition yet, mean for community health centers? Will they turn people away, for example?
Yeah, thanks, David. So, as you say, health centers serve a large proportion of the Medicaid population. Health centers serve 2.5 million patients here in New York State, so 2.5 million of our residents. And of those patients, 60% are now covered by Medicaid. So health centers are going to be disproportionately impacted by H.R. 1 and the changes on Medicaid because our patient population is so heavily reliant on Medicaid. So compared to other providers in the healthcare sector, we expect it's going to be a disproportionate impact that is going to fall on health centers. We anticipate that statewide health centers will lose around $300 million in revenue that they would have otherwise received from patients who are covered by Medicaid. So we're expecting a significant reduction in that Medicaid coverage.
And when you look around the landscape right now, does it seem like New York policymakers are doing anything to ensure that maybe there isn't that drop, that they're taking steps like engaging community partners to help keep people stay enrolled? Or do you see kind of the status quo and there is reason now to expect that people will lose their coverage?
Well, we know from the experience in other states when they've implemented work requirements that the administrative requirements that have been put in place have caused significant declines in enrollment, significant loss of coverage. We also know that New York is going to be very aggressive, that they're going to really be looking to do everything they can to maintain that enrollment. New York is still waiting to see what rules the federal government is going to put in place. So we haven't seen exactly yet what the state is going to do based on the past history, what we've seen with New York State in terms of their expansion of coverage, their expansion of Medicaid, their expansion of the adoption of the essential plan. We do anticipate that they are going to want to maintain coverage for as much of the population as they can. But they are really going to have to be following the federal rules. And we know that they are looking at changes to the essential plan because of the requirements in H.R. 1 that are going to cause people to lose coverage.
And so it's one thing to have people come to you with Medicaid and potentially have a form of reimbursement or payment, but that reimbursement, as we've talked about in the past, is not reflective of the cost to actually provide that care. When you and I talked during the waning days of the budget process last year, I think you framed it as something like these are 1999 cost levels that these are based on, and you're trying to deliver care in 2025, 2026. So how did that campaign to get an update in the reimbursement rates go last year?
Yeah, so we have not seen an actual reform to our rates that we want to see. There was an investment that was included in the budget last year of about $40 million, which was not close to what we were looking for, but we were appreciative that this was a down payment that we thought we would see going forward into future years.
So an investment that has reached out to your members, or an investment that you're still waiting for the checks to clear on?
So that money was included in the FY26 budget. The language was up to $40 million. The state always likes to give themselves some wiggle room on these things. As of January 30th, with 2 months left in the fiscal year, February, March, we have not seen a penny of that money. So we have been kind of waiting in good faith to see what would happen, anticipating that there would be some kind of rate increase. There has been some of the money from the MCO tax, which funded this investment, that has gone out to hospitals, to other parts of the healthcare sector, and we haven't seen any funding.
Well, in terms of the governor's executive budget, then, which is supposed to take effect April 1 and on, is there an anticipation that they are going to either give you an additional $40 million or up to $40 million? Or are you just thinking about spending that existing authorization in the next fiscal year?
So we had anticipated that there would be additional funding this year. And when we first looked at the budget, we thought that it included language that said that for FY27 there would be up to $40 million. And so we took that as as an addition onto the investment from last year. However, as we've looked further into the details, and you know that these budget documents are very complicated, and there's Article 7 language, and there's appropriations, and there's the fiscal plan. So the financial plan, so as we've looked into that and actually spoke with DOB and got confirmation that, in fact, the $40 million in FY26 was zeroed out and pushed forward into this year. So instead of getting what had actually been budgeted in FY26, the budget had showed that there was $40 million for 26 and $20 million for 27. When we saw that there was $40 million for 27, we thought, great, we've actually gotten an increased investment. But in fact, no, we've lost the $40 million from last year, and we have this up to $40 million that at this point we don't really have a lot of faith in what might actually be given out in that up to $40 million amount, given that we never saw last year's money.
So should I throw out this press release that talks about being grateful to the governor?
Yes, we are rewriting the press
I'll
release.
put that in the recycling bin. Got most of it in there. Then does that reform your ask at all for 2027? Because if you didn't get the $40 million and you were grateful for another $40 million, should you be asking for $80 million, or are you taking an even bigger swing and saying, hey, we asked for $300 million last year. Let's finally realize that $300 million, especially since you're telling everybody else we've got more money than God right now.
Our ask for this year is $300 million. That's the amount that we have calculated is the loss from HR1. And so that doesn't even address our very out-of-date rates, but that would just help to make sure we're not falling further behind. It would help to fill that hole that we know we're going to be seeing from HR1. And so that amount is $300 million. If we don't see that investment, we're going to be really challenged to make sure that we're able to maintain access for the population that is going to be showing up at our door. Right now, for health centers, our uninsured rate is about 2.5 times the rate of the uninsured rate across New York State, which is pretty low for New York State, about 5%. At health centers, the uninsured rate is about 13%. So that's today. As we just talked about, we know that there's going to be a lot of folks who are falling off of Medicaid, who are not going to be able to be able to afford to purchase coverage through the marketplace, people who are going to lose coverage through the essential plan, which was through no cost, so it'd probably be really hard for them to afford coverage. We expect a significant increase in uninsured patients across New York State. We are estimating that the uninsured population at health centers will triple based on the proportion of uninsured that we see now and what we see in terms of that increase of the uninsured population. So we're looking at going from 13% uninsured to almost 40% of patients being uninsured. And we think that's a combination of current patients of health centers losing their coverage, and people who are not currently health center patients losing their coverage, but when they're uninsured, they know that health centers will provide coverage. So we do anticipate that uninsured population is going to grow, and that's going to put significant additional financial strain on health centers.
Well, then let's think about the whole healthcare landscape more broadly, because if the community health centers, which seem to be that backstop in the healthcare system for the uninsured population so that they're not necessarily going to hospitals or relying on other providers, if your members and their footprint shrinks in any way, shape, or form, it's not like these people are going to stop looking for care. They're going to rely on other aspects of the healthcare system, and their financial situation is only going to get worse. So is the governor and potentially the legislature, if they don't make an increased investment in community health centers, are they starting off this sort of spiraling, escalating problem in the healthcare system potentially?
Yes, absolutely. As you know, the healthcare system is very interconnected, and health centers are really that front line. They're really that safety valve for the safety net. And so if health centers are able to see patients, to prevent chronic illnesses from becoming acute, to treat preventable kinds of conditions, that is going to really make a difference in downstream what's happening at the hospitals. So a couple of years ago, the health department had done a calculation that between 15 and 20% of preventable emergency room use was for dental care that could have been treated in a more appropriately in a setting. Health centers are one of the only places in the state where anybody with Medicaid can get dental care. Private practice dentists can choose not to accept Medicaid, and they often don't. And so health centers are the only place where somebody who's having a toothache, who's having an infection, can go to get care. And if they can't go there, they're going to end up in the emergency room. We're also seeing in a lot of our rural communities where there aren't other options, a really close interconnected relationship between hospitals and health centers. In one of our very small health centers in a rural area in the southern tier out in Olean, New York, we have a health center there that is really struggling financially. They provide most of the labor staffing for the labor and delivery in the small rural hospital in Olean, New York. If that health center cannot continue to staff that labor and delivery room, there won't be labor and delivery in that community. And likely that hospital will close. The closest alternatives for people in that area to the east is about 50 miles to, I think, Wellsville, there's a small hospital, or to the west, about 50 to 60 miles to Jamestown. So that means that there's going to be a huge gap where not only would there be no primary care, if there's no health center, there's not going to be any hospital care, there won't be any labor and delivery.
Any idea why the community health centers find themselves in this situation? Did somebody offend the governor at a party or something? Because this is a budget that there was expectations that there might be some painful cuts to healthcare, but we see a lot of money still flowing to, say, hospitals and nursing homes. But you're looking for dollar amounts in the millions, not even billions. So, I mean, what faux pas have you guys committed?
Yeah, that $300 million that we're asking for is 0.3% of the Medicaid budget. And so while some people might say $300 million sounds like a lot, as you know, in the Medicaid world, that's just,
The Greater New York Hospital Association does not get out of bed for $300 million.
Right. It's like they can just look under the couch covers and cushions, and there it is. And for that does make a point that there is $1.5 billion in additional funding in the budget for hospitals and nursing homes that health centers are not included. And we have that exact same question. Health centers need to be included in that pot of money because we're an essential provider, and as we've just said, it's going to have an impact across the board.
So you guys didn't insult Josh Allen or something?
Well, not out loud.
And you're holding your tongue for now, at least until the budget process is done. We've been speaking with Rose Duhan. She's the president and CEO of the Community Healthcare Association of New York State, which represents more than 70 healthcare centers all over New York, at least for now. Rose, thank you so much for making the time. I really appreciate it.
Thanks, David. It's a pleasure to be here.
Thanks for listening to today's edition of the Capitol Press Room. For an insider take on what's happening in state government, check out our Dispatches from Planet Albany show, available wherever you get podcasts or at capitolpressroom.org.
Join us again for Capitol Press Room, a production of WCNY Connected, Syracuse.